Which testicular cancer type has the highest recurrence rate? When it comes to testicular cancer, understanding the types and their recurrence rates is crucial for patients and their families. The two main types of testicular cancer are seminomas and nonseminomas, both of which are classified as germ cell tumors. These tumors make up about 90% of all testicular cancers. So, which type has the highest recurrence rate? Nonseminomas generally have a higher recurrence rate compared to seminomas. For patients with clinical stage I seminomas who are under surveillance, the relapse rates can range from 7% to 22%. Most studies suggest that the average relapse rate is around 13% to 18%. Interestingly, if the tumor size is greater than 4 centimeters, the risk of recurrence increases, with relapse rates climbing to about 15% to 18%. Even low-risk seminomas can see recurrences in about 4% to 14% of cases, typically occurring within the first 2 years after treatment. These recurrences often happen in the retroperitoneal lymph nodes. On the other hand, nonseminomas tend to relapse earlier and more frequently. Research indicates that around 15% to 20% of patients with nonseminoma testicular cancer experience a recurrence after their initial treatment. These recurrences often occur within 6 months and can affect areas such as the abdomen, lungs, and inguinal region. A significant factor in predicting recurrence risk in nonseminomas is the presence of lymphovascular invasion. This factor allows for better risk assessment than tumor size alone does in seminomas. Despite these differences, both seminomas and nonseminomas have excellent overall cure rates, exceeding 90% when treated appropriately. Recurrences are usually manageable with additional therapies, which may include chemotherapy, surgery, or radiation, depending on the type of tumor and where the relapse occurs. Regular follow-up is essential for early detection of any recurrence, typically involving physical exams, tumor marker tests, and imaging studies. In summary, nonseminoma testicular cancer has the highest recurrence rate compared to seminoma, especially when risk factors like lymphovascular invasion are present. Seminomas, while having lower recurrence rates, are still significant and influenced mainly by tumor size. Careful surveillance after initial treatment is vital for both types to ensure timely management of any recurrences. Always consult healthcare professionals for personalized advice and treatment options.